I'd like to share a few of my experiences during patient care in the COVID pandemic and some of the things I've learned about myself along the way. Let me start with a little background about myself and about the situation. I've worked in the same family practice that I co-own for the entire 20 years of my nurse practitioner career. We have a staff of 16. We're located in the Research Triangle Park area of North Carolina. Many of our patients often travel for work and pleasure. As a small business owner, I'm very involved in the day-to-day management of my practice. On March 2nd, North Carolina had its first confirmed COVID-19 case. The person actually traveled from Washington State. Soon afterwards, cases started to multiply daily in North Carolina. On March 12th, my practice as a nurse practitioner changed forever as I've known it. That Thursday wasn't a typical day. I was in the office on my day off to launch a telehealth platform to increase patient visits remotely. I had 2 patients scheduled to trial the telehealth platform before educating the remainder of the providers and staff. Little did I know how important and timely that trial would be. Telehealth has been essential in keeping my practice connected to patients during the COVID precautions. We now see about 90% of our patients via telehealth. I completed the telehealth visits that morning, and earlier that afternoon, we received a call from one of our patients that had just returned from a business trip. She was concerned she'd been exposed to COVID-19 and was exhibiting symptoms. She complained of a persistent dry cough, a temperature of 99.9, severe body aches, and fatigue that presented about 4 days prior. She had traveled to Kansas City via RDU, our local airport, on March 2nd, and returned home on March 5th. She traveled through RDU during a time frame that some of the first confirmed positive cases traveled to our area. She needed an appointment for evaluation and screening, and per the CDC recommendations and guidelines, she called us, her primary care provider, her healthcare home, the place that knew her health history best. So after an assessment of the situation, I thought, is our office prepared? Do we have proper PPE? We do, because about 2.5 hours away, I purchased PPE N95 masks from a home improvement store, about 21 to be exact. They've been on back order from my medical supplier well before the U.S. had its first confirmed COVID-19 case. Actually, they're actually still on back order. We had a small supply of what we call our usual OSHA PPE, gowns, gloves, and goggles. I thought, do we have enough specimen collecting materials? We had a total of 15 kits that we usually test herpes and flu virus for. Our in-house lab told me that those specimen collection kits were on back order as well, and they were not sure when they would be available. There was no ideal place to test to see her in our office, so I saw her in the next feasible location, the parking lot. This limited potential risk to our office staff and concerned our limited PPE supply. Then I thought, am I ready? So I gathered my PPE, my mask, goggles, gown, gloves, materials needed for my exam, specimen collection materials, and materials I needed to clean up afterwards. My adrenaline was on high, as well as my emotions. It had been nearly 20 years since I'd worn an N95 mask for patient care, but it was like riding a bicycle. Donning my PPE came back to me like second nature. The visit was completed with our first specimen collection collected in the parking lot. It wasn't until my visit was complete that my emotions caught up with me. Like many nurses, I was focused on addressing my patients' needs. I wasn't thinking that I needed to cancel dinner plans with my elderly mother-in-law for later that evening. I didn't think, was my guest bedroom prepared? I've been sleeping separately from my husband since my first COVID swab collection. Those were just a few things I hadn't considered as I put my patients before me and my family. Yes, I was fearful as I replayed doffing my PPE. Did I forget something? Did I contaminate anything? Did I clean all my supplies thoroughly? I spent the remainder of the day reviewing CDC guidelines and the World Health Organization sites, creating protocols to guide the office in the weeks to come. Little did I know that those protocols I spent hours on would be revised in less than 24 hours. The CDC and World Health Organization changed their guidelines, it seemed, several times daily in the first weeks of COVID management, it seemed. I took to verbally updating our staff on changes to make sure they were clear on the latest versions of our plans. I felt if I could look them in the eye, I could confirm their understanding of our changes. The next week, I saw a remainder at about 8 patients, COVID suspect patients in the parking lot, and the balance in the office and telehealth visits. I continued to roll out our telehealth throughout the office. I brought on additional providers up to speed in regards to providing telehealth visits. I went over the process with clinical and front office staff. I added an additional nurse practitioner as a COVID screener in the parking lot. I tried to cover the needs of the patients as the calls we received from patients with concerns of symptoms were increasing. Anxiety in the community and our office was on the rise. I could tell the staff was feeling the pressure of uncertainty. You could feel the pressure in the office. Education of the staff was high priority and served as a foundation for education for the patient. Education was key in reducing the concerns of patients and both staff. What are the symptoms of it? What patients qualify for outside parking lot visits? What patients were considered inside the office visits? What was safe to be seen as a telehealth visit? What modifiers could we use for telehealth visits to ensure that we had adequate reimbursement from insurance companies? Unfortunately, there was no one unified location to research these answers. To research the answers to these questions. So I spent much of my non-patient care hours and many times at night scouring the internets for guidance. We set protocols for who would be seen in the office and in the parking lot, who would qualify for one of the remaining 14 COVID nasal swabs. How do we safely reuse our N95 masks? What happens when the straps to the mask break? Who and how could we find a replacement? What happens when we use our last specimen collection materials? It became clear to me that patients' needs went well beyond our supplies in regards to PPE and testing materials. My frustrations were high. I shared my concerns with news stations and newspapers. I wrote emails to my state and federal legislators voicing my frustrations. I felt ill-prepared to meet the needs of my patients and the community. I felt like I was sent into battle without all the necessary equipment. I used every avenue I could find to share my concerns and hope for change. I tweeted this picture with the comment, "This is my new reality, N95 repair, mask repair," to the North Carolina governor and the Secretary of Department of Health and Human Services. My nurse practitioner colleague called the Department of Health and Human Services requesting additional PPE supplies to screen patients with COVID symptoms. Just the previous day, the state officials said that North Carolina had plenty of PPE, but I thought to myself, not my family practice. I didn't get a reply to my tweet, but my call did result in 20 additional KN95 masks, 50 surgical masks, and 3 cloth isolation gowns from the County Sheriff's Department. As a result of the tweet, I also was contacted by 2 news reporters for interviews, yet another way to share my frustration of the lack of PPE and testing materials. Hope that any of those interviews could provide a glimpse of the care of us providing care to COVID patients in the outpatient setting. I had my first emotional breakdown within the first 3 weeks of COVID management in the office. I spent the numerous evenings, that week prior, trying to make sense of my parking lot's patient's 89% oxygen level without obvious signs of significant respiratory compromise. He had a little wheezing in his bases of his lungs, but no significant respiratory distress. He came to our office on Monday morning after being discharged from the emergency room on the previous Friday and Thursday. He presented with fever and chills. And yes, his pulse ox was 89% with wheezing in our parking lot. So I thought he needs an albuterol nebulizer. And how would we do that without power to our parking lot? So I had him move to a parking spot closest to the outlet. And we ran a 100-foot drop cord that we purchased during his visit. I improved his pulse ox to about 91% with 2 albuterol nebulizers, but that wasn't enough of an improvement. So time to call the EMS to transfer him to the emergency room for evaluation and management. I truly expected him to be hospitalized, so I was surprised when I saw him driving away in his pickup truck later that day. I was baffled and I called him when I got back into the office and pulled up his record from the hospital record system. He had been discharged to self-isolate and monitor his symptoms after getting his pulse ox up to 96%. He had a chest x-ray that showed viral process was present. This was a change from a previous x-ray that previous Friday. He had a nasal swab in the emergency room that was to reflex to a COVID test if negative. So I instructed him to continue his self-isolation until he got his results from the emergency room. I told him to return to the emergency room for any respiratory distress. My emotional breakdown actually occurred that Friday morning after his hospitalization. I'd been prepping for my day, reviewing results and correspondence, and I came across the hospital updates showing that he'd been admitted with respiratory distress. He was in the ICU now. His COVID swab was actually positive and confirmed that his symptoms were COVID-related all along. I was angry, I was frustrated, I was exhausted. He'd had 3 visits to the emergency room before he got a COVID screening. My patient I tried to keep out of the emergency room in need of critical, and perhaps presenting with a critical condition. Deep down, I was wasn't completely surprised because in my late hours of research, I came across information about the hypoxic patient. This patient can decompensate quickly and require medical ventilation. Unfortunately, this left me even more concerned about his health status. He was high risk, an African-American male with hypertension, diabetes, and high cholesterol. Tired and frustrated, I sent an emergency text to 2 of my nurse practitioner colleagues. By the time I finished the second text, I was in tears. I needed a deep breath. My heart was heavy with anger and frustration. I tried to prevent this from happening. I was trying to put his care into the hands of someone that was more capable of monitoring his status. My nurse practitioner colleagues consoled me. They gave me validation. They listened, giving me enough calm to continue the day of clinic. Thank goodness for my nurse practitioner tribe because they ground me. I like to share these 2 stories. I like to share those 2 stories because I learned a lot about myself and my role as a nurse. I realized that my role as a nurse extends well past that of a caregiver. I'm a researcher. I gather information about COVID symptoms and treatment. I'm an educator. I provided education to my patients as well as my family and my staff and friends. I'm a counselor. I provided support to patients concerned with COVID symptoms. I made phone calls to offer reassurance when their symptoms of COVID were still present despite having a negative COVID swab. I calmed anxious staff and nurse practitioner colleagues when uncertainty was at its highest. I was an enforcer. Yes, an enforcer. I'm certain that I'm considered the infectious disease police in the office. I went over proper mask use. I reviewed good hygiene repeatedly. I was an innovator. I was creative in problem solving when my resources were limited. I was an advocator. I shared my concerns and frustrations around lack of PPE and testing supplies, and I took every opportunity to reach out to legislators. Here are a few things I'd like you to remember. Acknowledge your emotions. I feel like I was on an emotional roller coaster for several weeks at the start. Remember, self-care is essential. Take care of yourself. Your health depends on it. Get plenty of sleep, eat healthy, plan regular relaxation time. I took a deep dive into self-help podcasts. I can always find an extra bit of encouragement there. Make sure you have a reliable source of resources. It is key as information is ever changing. I would also say surround yourself with family and friends for support. And remember, patient advocacy extends past the bedside. Contact your federal and state legislators to share your concerns. Nurses are considered the most trusted profession in the past 18 years. The public trusts our opinion. Let's make Florence Nightingale proud in the year of the nurse and the midwife and every year. Thank you.